In the past, I've endured more sinus issues than I can count. Days where the pressure felt like a weight behind my eyes, nights when breathing through my nose felt impossible, moments when dizziness or ringing in the ears made me stop everything I was doing. So today, from a place of genuine understanding and care, I want to give something meaningful back to you. I want to offer techniques that may help reduce congestion, ease pressure, soften pain, and help you breathe a little more freely. If you've been struggling, if you've been exhausted from trying to function through that heavy fog of sinus discomfort, if you're just wishing for a little relief, this is for you. I see you, and you're not alone. Before we begin, I want to introduce myself. I'm Dr. Rosalie, and it's my mission to guide you through simple, gentle techniques that many people find supportive for sinus comfort and nasal drainage. These are techniques you can do carefully at home, using your own hands, your breath, and your awareness. They aren't meant to replace professional medical care, but they may help you feel better in the moment, and sometimes that's exactly what we need. To understand why these techniques matter, let's take a quick journey into the structure of your sinuses. Your paranasal sinuses are a group of 4 paired air-filled spaces surrounding the nasal cavity. When they function smoothly, they lighten the weight of your skull, warm and moisten the air you breathe, and give resonance to your voice. But when they're inflamed or congested, these normally open spaces can feel like tight, pressure-filled chambers that affect far more than just breathing. The maxillary sinuses sit under the eyes, deep within the cheekbones. The frontal sinuses rest above the eyes, just behind your forehead. Between your eyes lie the ethmoidal sinuses, tiny interconnected cells, and behind your eyes, tucked gently in the center of your head, are the sphenoidal sinuses. All of these spaces connect and communicate with each other, and when one of them is irritated or backed up, the pressure often radiates across the entire region. I want this to be comprehensive. I want you to feel like you've truly done something meaningful for yourself by the time we're done. We're going to focus on drainage, on releasing tension, on widening passages that may feel small or constricted right now. We'll also work on opening the eustachian tubes, those tiny channels that connect the space behind your nose to your middle ears. When they're restricted, you might feel fullness in your ears, ringing, dizziness, or a sensation like you need to pop your ears but just can't. It can be frustrating, and it can affect your sinuses too. We're going to start with a technique I absolutely love, something gentle yet incredibly comprehensive. It's called nasal septal mobilization. This technique involves using your hands to create slight, careful movement around the nasal region and cheekbones to encourage openness and drainage. We'll begin on the left side. Take your left hand and place the fingers just under your left cheekbone. With a steady but comfortable pressure, push up and slightly outward, almost as though you're guiding the cheekbone gently toward the direction of 10 o'clock on a clock face. With your right hand, place 2 fingers along the bridge of your nose, slightly toward the left, and gently pull the tissue over. You're spreading the area while also creating a bit of stretch and mobilization. Hold this for 10 seconds, breathing softly through your mouth. It's okay if it feels a little strange at first. What matters is that the touch remains comfortable and controlled. You may even feel some warmth or a subtle shift within the nasal cavity. Now let's move to the other side. Switch your hand position so your right hand goes under your right cheekbone. Push up and out, as if you're guiding that cheekbone toward 2 o'clock. With your other hand, place your fingers on the nasal area and gently pull it to the side. Hold this for 10 seconds, keep breathing gently, and allow yourself to feel whatever small openings or ease may begin to occur. Even the simple act of touching your own face with intention can soften tension you didn't realize you were holding on to. Sometimes we only notice how tight we were once that tension finally begins to melt. Next, we're going to open the nasal passages more directly. Many people feel results from this very quickly. Bring your fingers, whichever feel most comfortable for you, along the sides of your nose from the tip upward toward the top, right along the center ridge. I personally like to use my thumbs because they give a stable, strong pressure. Press inward slightly, and then pull outward, almost like you're gently widening the tissue on each side of the nose. As you do this, breathe in and out through your nose if you can. You may notice that the air moves a little more freely, or that the passages feel a little wider. Continue this motion for about 10 seconds, pressing in firmly enough to feel movement, but never so hard that it becomes uncomfortable. Think of it as helping your nose open like a door that's been stuck for too long. Now we'll focus on the eustachian tubes. These small channels often play a bigger role in sinus discomfort than people realize. When they become clogged or inflamed, they can create pressure in the ears, ringing, dizziness, and headaches. We're going to gently encourage them to open. Start on the right side. Take your left hand and place your thumb under your right cheekbone, pressing in and out, just like we did earlier. With your right hand, reach for the lower part of your ear, the soft fleshy part, and pull it straight out to the side. Not up or down, just straight out. This gentle traction can help create space in the pathway that leads toward the middle ear. Hold this for 10 to 15 seconds, continuing to breathe comfortably. You may feel a faint shift, a slight lightening, or even a tiny pop. Or you may feel nothing at all right away, which is perfectly fine. These structures sometimes respond gradually. Now switch sides. Take your right thumb, place it under your left cheekbone, and press in and out again. With your left hand, grasp the lower part of your ear and pull it straight outward. Hold for another 10 to 15 seconds. Let your breath stay slow and easy. Feel your body settle into the movement. Imagine the tension in those small passages, gradually letting go. And now, we'll finish with a technique that many people describe as almost magical in its ability to shift sinus pressure. This one uses breath and proprioception, your brain's awareness of your body and space, to trigger a reflex that can help open the sinuses. It's simple but surprisingly powerful. You're going to take a deep, full breath. One that fills your lungs, in a way you rarely allow yourself to do during a stressful day. Once your lungs are full, pinch your nose closed with your fingers. Hold the breath. Keep your nose pinched. Slowly tilt your head upward, lifting your face toward the ceiling. Stretching the front of your neck slightly. Hold the breath there. Stay with it as long as you can comfortably manage. What we're doing is creating a temporary shift that encourages your brain to adjust the pressure in your sinus cavities. Keep holding. You might feel a little lightheaded. That's okay, as long as you're still comfortable. When you absolutely can't hold your breath any longer, release your nose and exhale through your mouth, allowing your head to gently return to neutral. Give yourself a moment. You may feel slightly floaty or airy for a few seconds. Let your body settle. Notice any subtle shifts: a softness behind the eyes, an opening in the nasal passages, a decrease in the pressure along your forehead or cheeks. These changes can take a minute or two to fully settle in, so just breathe naturally and allow your body to respond. You can return to any of these techniques anytime you need them: morning, evening, or even during the day when congestion hits unexpectedly. You can do them individually or combine them, depending on what feels right for your body. Most importantly, be gentle with yourself. Sinus discomfort can be draining physically and emotionally. It can pull energy from your day and make even simple tasks feel heavier. But taking a few minutes to care for yourself like this, with intention and compassion, is powerful. You deserve to breathe with ease, to feel lighter, to feel more present in your body. And I'm here, deeply grateful to guide you through that.